Hello viewers, it's Dr. Kasango Joet again and Derek. Welcome back to our channel. As we told you that we'll be discussing some of the conditions that people really sometimes neglect. Today, we want to share with you some of the 14 signs that are deadly of cancer that you are always most likely to ignore. You know, cancer is some of the conditions that are common and their signs are not really specific. And you find that many people present with these signs, but because many people ignore them. And in this particular video, we want to show you or to give you some of the signs that you are most likely to ignore, but yet they signify something big like cancer. Mostly cancer of the pancreas, which is a very rare cancer, but it can be life-threatening. You know, knowing the warning signs of cancer can be the difference between the life and death. You understand? Because you can easily go and seek for medical attention as early as possible so that you can be put on a good treatment or even surgery for cure. So just the mere knowing those warning signs of cancer can be the difference between life and death. And the earlier cancer signs that most patients face but they ignore them are many, you know. Yet the earlier cancer is called, the more effective treatment is. So it is very important to be aware of the red flags, you know. It's very important to be aware of them. And in this particular video, we want to look at the pancreatic cancer. Pancreatic cancer is one of the deadliest form of disease and is particularly hard to spot as it does not cause any signs or symptoms in the earlier stages. The silent killer is the 11th most common type of cancer in the Western world and the 6th highest cause of death. You can imagine. It has the lowest survival rate of any common cancer in the world. So when a patient has the pancreatic cancer, the survival rate is very small. Research shows that it has a survival rate of 3 months. Almost a half of those patients that are diagnosed with pancreatic cancer die within the 3 months of the diagnosis. The disease affects a large gland that is part of the digestive system, the pancreas, and it is located behind the stomach and the liver. This gland has two major functions: dripping the digestive enzymes into the gut to help breaking down food and releasing the hormone insulin and glucagon to regulate the blood sugars. So when this gland has any issue, we shall see the patient sugar levels going high. Pancreatic cancer occurs when the malignant cancerous cells form in the tissues of the pancreas. And these are some of the symptoms that could be easily dismissed as something less serious. One, when a patient has pancreatic cancer, he or she will present with indigestion, sometimes called heartburn. Is a common symptom of pancreatic cancer, which can be very easily ignored or thought of as something else, like PUD, peptic ulcer disease. A lot of time, people might just take over the counter remedies for persistent indigestion. It is not something that will automatically see you running to the general practitioner. But there are times when it might line up with other symptoms like pain in your tummy or back pain, and with several niggling things happening which could suggest pancreatic cancer. The second symptom can be tummy or back pain. Again, many of us experience tummy or back pain from time to time, but especially when they are combined, are common symptoms of pancreatic cancer. The tummy pain can be anything from dull to throbbing pain that travels to your back. It may be around your bra line if you are a female. It is not lower back pain, and it is often between the shoulder blades. It may also be worse after you eat something, and it doesn't tend to go away easily. So that is the pain you experience. Once you get that pain, it's better you see your doctor. Number 3, some patients with pancreatic cancer always have unexplained weight loss. Weight loss is a typical symptom of many cancers. When connected to pancreatic cancer, might initially be seen when people are not really trying to lose weight and are eating relatively well. It is first made obvious when clothes are getting loose. That's when you realize you're losing weight. Another symptom we always see in patients with pancreatic cancer is loss of appetite. Weight loss can often be related to appetite loss, which is another easily ignored pancreatic cancer symptom. It can range from people thinking they are not really that hungry to having no appetite at all and not being able to face food or feeling full after very little food. Another symptom that these patients with pancreatic cancer face is jaundice. If you notice your eyes or skin look yellow, this is a sign of pancreatic cancer too. It is called jaundice and it's caused by buildup of bilirubin bile. Not everyone with pancreatic cancer will get jaundice, although it is very prevalent. It only tends to occur in people whose tumor tends towards the head of the pancreas, as it can block the normal flow of bile in the digestive system. Another symptom, number 6, that these patients face but they ignore is itchiness. Your skin might become incredibly itchy before you develop jaundice. I'm not talking about the little itch. It would have you scratching to a crazy degree. That is the kind of itching you will face because of the buildup of bilirubin. Another symptom patients ignore is the changes to the bowel habits. If your poo has changed a lot, it could be a warning sign. Pancreatic cancer patients often have specific bathroom problems, suffering with forms of diarrhea or constipation. It is very, very important for the patient to seek medical attention if they experience diarrhea. There are many causes of diarrhea, but this is something we call steatorrhea, when there is fat yellow in color, which also happens in jaundice. It is the type of poo that does not flush away. So when these patients go to the toilet, they can't flush it well. If the patient does not describe the specifics of the diarrhea, it can waste a lot of time to get to the diagnosis, and the time of the essence. You understand? So when you cannot ask this patient very well to describe the kind of diarrhea is facing, you will delay to get the diagnosis of the pancreatic cancer as a general practitioner. So it is important, a patient, when you see that, you seek for medical attention. Another sign that these patients with pancreatic cancer get is recently diagnosed DM. If you have recently been diagnosed with DM, that's diabetes mellitus, or suddenly finding your usually well-controlled diabetes is less so. You are kind of a patient who has been having diabetes but well controlled, but from the blue it's no longer controlled. This is something to keep an eye on. Every small amount of people with recently diagnosed DM may have pancreatic cancer because this pancreatic cancer can stop the pancreas producing enough insulin, which can lead to diabetes. So it is very important for the patient to watch that. Research has shown onset of type 2 diabetes in people older than 50 years could be an early sign of pancreatic cancer. So when you see a patient above 50 years and is developing diabetes, take serious. Take note of that. It's especially likely in people with the low body mass index who are losing weight and who don't have any family history of diabetes mellitus. Another common sign that our patients normally ignore is the nausea, feeling, or being sick can be another pancreatic cancer symptom. Sometimes people can vomit, but that is not as common as feeling sick. Another common signs that patients always ignore is the blood clots. Blood clots are actually an uncommon symptom of cancer, but they might present with breathlessness or swollen leg and go for a scan and find out they have got cancer of the pancreas. It is exception, but clots are symptom and could be leading to the fact that there is an underlying problem. Another symptom is fatigue. Feeling tired is normal, It's normal part of the everyday life and can be a symptom of anything. But in some cases, it can be a sign of pancreatic cancer, mind you. If you rest and you can't recharge your batteries, coupled with some of other symptoms like ongoing pain, steatorrhea, which drain a person physically, it could be another symptom of pancreatic cancer. Another sign that our patients ignore is fever, shivering, and feeling unwell. Although these symptoms are pretty rare in pancreatic cancer patients, they can be a sign of an infection linked to jaundice, which itself could be a symptom of cancer. An infection like this requires immediate medical attention. Another symptom is difficulty in swallowing food. Although the cancer does not actually cause the problems with esophagus, it may just make swallowing feel abnormal. The cancer can make a person feel full, although they can think the problem is to do with their swallowing. It is often the fact they are just not able to fit in the food. Lastly, I can talk of depression and anxiety as a sign that we always ignore. Mental health issues are probably not something that would make you think you have pancreatic cancer. But depression and anxiety without obvious cause is a common symptom in patients with CA pancreas. Low mood can go hand in hand with pain and fatigue. Again, it is taking these things as a whole rather than isolation that will make a difference. You don't have just to rely on one of the signs and think you have cancer of the pancreas. Otherwise, it is important to always see your doctor once you notice any of those signs that I've talked about, and you're able to do more investigation. Please seek medical attention from a qualified general practitioner or a specialist in case you notice some of those symptoms. Remember, the earlier the diagnosis, the better the treatment outcome and even cure through various surgical procedures. I want to thank you so much for listening. I hope this video has been of help. Leave your comment, like your question in the comment section below. We will be in position to answer some of those questions in the next video when we come back. I remain your own Dr. Kasango Joet and my brother Derek, who has made sure that we come here and give you a light on some of the issues concerning pancreatic cancer that most of the patients, most of the people ignore, yet they can be a warning sign for early diagnosis of this condition. Thank you so much. See you next time. Bye.